Anyway, so this is one of those Pharaoh wraps that they use for the lymphedema that you can put on first thing in the morning.
Yes.
And do you like how it works, or?
No.
It's
much easier. I mean, because I can't get down to put. I've since the break.
Mm-hmm.
I have always worn.
Sorry. Okay.
Compression hose.
Okay.
And I would prefer that now,
Mm-hmm.
but I can't get down there.
Okay. So your ankle fusion here was a year ago, and this is still really sore.
Yeah, it's
okay. And this swelling got worse when you had your knee done a couple months ago?
Oh, yeah. I mean, I didn't have lymphedema. I mean, it might have been a little swollen, but...
May I? Is
sure.
that okay? We'll put it all back on.
Okay.
Okay. So anything that touches your ankle right now is excruciatingly painful.
Yeah, and this comes across here.
It cuts, I can see.
And so that is, I think it's a nerve or ligament or something, because this hurts like hell and is tingly.
Okay.
And it just compounds. Plus, this doesn't, I don't think this serves me well.
The swelling.
Yeah.
Yeah.
I mean, that it's all pushed up there in the middle of the, when I wake up in the morning, it's nowhere near that.
Okay.
I mean, it's a little bigger, but it's nowhere near that.
Okay.
And the same thing happens on this one, and this is down here. Terry tried to loosen this up so that it was not so tight on my nerve root.
And we can maybe show you a way that you can put some pads around this area, right where the scar is, and right where there is a nerve that comes out, right there, that goes down the foot and over to this side.
Yeah.
And so we can show you a way, I'll put some pads on here on either side, so that when you pull up the compression sock, that it doesn't put pressure right on there.
Okay.
Okay? And it looks like also that's right where the scar is.
Yeah.
From the ankle fusion.
Well, I can't tell you which scar is from what.
Okay.
The original surgery, the removal of the metal,
Okay.
or the
ultimate fusion. Okay. So are you comfortable with your foot sitting just like that, or do you want me to pull the bottom out a little
No,
further?
actually, it's fine the way it was.
Okay.
The way it is now. It was hard on my ankle, no, on my heel, a couple minutes ago, before you tilted me back.
Oh, okay. So then we'll go ahead and we'll take care of the calluses, whatever nails need cutting. And then can I take off this kinesio tape to see the callus on the heel?
Yeah.
Okay. Maybe I should let you do that.
No.
No? It hurts just as much when you do it?
Yeah.
Okay.
Well, I've never taken it off, because it gets changed at Terry's
Okay. Oh, and when do you see him next?
tomorrow.
Okay. All right, well, let's start with nails. And, yeah, we can start on this one. So you can't, I'm sure you can't bend any of this to get down to it.
No.
And if you just had a total knee done.
Oh, that just complicated it.
Right.
And because I had lymphedema, it was then, I mean, my knee, I was afraid. I went to all that trouble to have a knee done, and then it wouldn't work because I couldn't have any physical therapy.
Okay. Well, the lymphedema is a diagnosis that will allow you to come in here every couple months and have me do this, just to keep you comfortable so it doesn't get this bad again. Okay?
Okay.
Now, are they thinking that the swelling in the leg, once the knee starts to heal, is going to go down a little bit?
Well, it is down at night.
Okay.
And when I get up in the morning, it's fine. And then I put these things on, and then it all puffs up at that point down there.
Well, what about just compression socks?
That's what I'm saying. I'd love to have compression socks, because they got the lymphedema under control with the wraps for like 4 weeks or 6 weeks.
Okay.
But I can't get down to get my compression hose on.
Well, they do have those things that...
I have 2 of those.
Oh, okay.
If somebody could help me, show me what's the best way to use them, I just look at it and I try to put the sock in the center of it, and I can't figure that out at all. I mean, I just think, is this gonna work?
That little thing that looks like a cage.
Yeah.
Yeah, I have one patient, he brings it with him every time he comes here, and he doesn't want us to help him get his socks back on. He just sits here for 10 minutes after the appointment. And, yeah, so I've seen
And
him
so
do
it works.
Yes, they do work.
Okay, well,
Now, the other thing you could do is you could go look online. The only place I ever hear the terms to don and to doff, so donning and doffing your socks,
yeah.
is when they talk about socks.
Oh,
It's very strange. And there are several different options that you can find online for sock donners.
well, that's where I've gotten
Okay.
2 of them.
The one that you got. Okay.
Yeah.
Well, bring it with you next time.
Okay,
And I would be happy to write the prescription for some compression socks.
okay.
They can be thigh highs, they can be knee highs.
I have always worn knee-high with silicone tops
Okay.
and open toe, just because it's so much easier to get them on.
I'm ready. Okay.
So, I don't know the size,
Mm-hmm.
because I don't know how you measure, and I've always had somebody measure for me.
Okay. So when I send you to the Orthotics and Prosthetics lab
Yeah?
to have the rocker bottom put on that right shoe, I believe that they do that as well.
Oh,
And they can help you, as long as I write the prescription,
okay,
they can help you, they can measure and do all that.
okay.
And get the ones that you like. Because I don't know who makes them with silicone tops.
Juzo.
Oh, okay. Now I know.
And they also do an open toe, which with the...
Juzo.
Uh-huh,
I've never heard of that brand.
really?
But, you know, I'm not in the business of working
Right.
with those every day. I do work with patients who work
Yeah.
with them every day, but I will definitely look into those.
But they have a little sleeve you put on your foot,
Mm-hmm.
so then that slides, your toeless compression slides over it,
Mm-hmm.
and then you pull it out,
Yep.
which made it possible. Does somebody else make those?
Yes.
Oh.
Or makes the device, they have a device that kind of rolls on and off that you roll the sock up on. I'll show it to you after. It's a company called Sigvaris.
Oh, that's what I have.
Okay, and they
Today.
have kind of this gel thing, this gel that you roll it up in,
Oh.
and it makes it easy to get it on and off.
Oh,
Or to don and to doff the sock.
yes.
I don't know why they use those terms. All right, well, this foot looks pretty good. I don't see anything huge except this callus right here. So let's go ahead and we'll get the calluses.
Toned down, or will it always be?
Well, it's your longest toe
Yeah,
by a lot.
yeah,
So it's always going to be what hits the front of the shoe first.
okay.
But there are some gel type pads that I can set you up with that will help take some of the pressure and friction off of it.
Okay. Terry said she'll be able to figure out whatever. We just want to have her look and have her start figuring out for what you need.
Yeah. And you know, we're not going to get everything fixed on the first visit, but
Right.
we'll get the process started for a few of the things, first and foremost, to make sure that that fusion took.
Yeah.
Because you shouldn't be having that much pain and I shouldn't be able to move it.
So now my other question is, in order to have therapy on your knee,
Mm-hmm.
I think they have been handling me, because it's just not it's not an easy orthopedic rehab therapy for knees.
Mm-hmm.
And my ankle has been hurting almost as much as my knee has
Well,
been.
and that's why I say the first thing we need to find out is the fusion of your ankle complete? Or
So,
did part of it not heal correctly?
or could it have been hurt during?
No, if it's fused, it would be pretty difficult to break it.
Okay.
But if it didn't completely fuse, and I can cause that much pain by trying to move it, and it feels like it is moving a little bit, then we need to get that CT.
And I don't know how much pain by you trying to move it, or just where your hand was on my ankle?
Well, it's both, because when I was
Okay.
trying to move it, you wanted to jump off the chair and smack me. I could see it in your eyes.
You know, you're probably right.
But then the other joint right below it that goes in and out,
Yeah.
you know, that was also very sore. So let's see what's going on there, and we can work with the physical therapist and kind of figure it out.
Okay.
So keep doing what you need to do for the knee.
Yeah, I just have to make sure that.
But it doesn't have to be brutal, you know, it can go slow, and it doesn't have to be explosive in the way that you do the exercises.
Yeah.
Okay, but this is going to feel a ton better, I think.
Oh, I think so too.
Just getting this callus and this nail down.
Yeah.
Now, you said your name on the video. I don't know if you realize that.
No.
Do you want me to?
No.
Do you want me to take it out?
Yeah, probably.
Okay.
I forgot to tell my foot to smile during it anyway.
No, I mean, I'll take out where you said your name.
Okay.
We'll leave Terry's name in.
Okay. No, I had no idea.
Okay, so I'm going to take off this kinesio tape now.
Sure.
And we'll see what's going on with the heel calluses.
Or maybe there aren't any. I don't know.
Well, there's a little bit right here. I'm going to bring you up a little bit. Okay. So around the back, I don't see anything. It's right where he was trying to move that fat pad back underneath, where you have some callus, so I'll just trim some of that down. And then the orthotics that you have, they have a good rubber cushion right under this heel. And so we'll do that same thing with the new ones.
Okay.
Because if you're not getting the fat padding, we'll get the shock absorption from the orthotic.
Yeah. And that's it. There's no shock absorption right now, and it goes right to my ankle.
And my concern is after a year, that ankle shouldn't be so painful. And so,
It was good for a while, and then
you mean while you were in the walking cast?
yeah, probably. No, I was just wondering if maybe this all started with the knee in therapy and whatever.
You mean the pain in the ankle?
Yeah.
Okay. Well, we'll get the CT, and either we'll figure it out or we'll put your mind at rest that everything there is fine.
Well, you just need to know that I can't do any more surgeries.
I'm not talking about any more surgeries.
That's just exactly what I wanted you to say.
We're going to take it one step at a time here. You know, let's first see what we're dealing with. My sense is most likely that the fusion is fine and that it's the joint right under the fusion that's becoming a little bit arthritic. That's what I expect to see.
Yeah, well, he was promising me I wouldn't have any arthritis.
Yeah, well, and he who shall remain nameless
Yes,
promises a lot of things.
I know.
And we see a lot of his patients here afterwards.
Yeah.
That wasn't a slam.
No, oh no, and you know, and I'm not agreeing with it at all, that if it's a slam.
It is not.
No.
Okay, so let's go ahead. Oh, one more here. Scoot this over a little bit. There we go.
This, okay. That's kind of the spot, I think, that when I'm walking, that I think, oh, that hurts over there. I have to remember to say something to you about this.
Yeah. Because this is where you're bearing so much of your weight right now,
Yeah.
because you've had the right ankle done, then you had the right knee done. So this foot has gotten a lot of pressure on it.
poor right ankle has had a surgery, 1, 2, 3. That's way too many times.
I think once you get the rocker bottom sole on your shoe,
Uh-huh.
you're gonna notice a big difference in that pain as well.
Will I fall on my face just learning how to walk?
You will not, it's not that drastic.
Will I rock over or?
You will not.
Okay.
Do you remember MBT shoes that were very popular?
Oh, yeah.
They were rocker bottom shoes.
Oh. Well, I never had any, so I never learned.
Yeah. It gave people good gluteus maximus muscles.
Oh.
But, okay. I'll go back over one more corn here. And one more pinch, Callus.
And how do you get the form for the orthotic? Is it a sand or is it a?
No, we make a 3D scan of your foot.
Really?
Yeah, we used to do plaster molds,
Yeah.
but then the 3D scans are easier, they're cleaner.
And a little more accurate, my guess is.
Yeah, and they can go right to the lab. Relax. Now, let me just show you the pads that I'm recommending for right here.
Okay.
And stay with us.
Okay.
All right, so we use these for all kinds of things, but we call these, strangely enough, U-pads. Okay? So what we're gonna do is we're gonna take the U-pad and just cut it right in half like that. All right? And you can take off that extra little piece right there. Basically, I'm looking to make just kind of 2 bars.
Okay.
And I'm gonna recommend that you try just one on each side here, where you feel the sock pinching.
Uh-huh.
It was kind of right here, wasn't it? Or higher up? No, it's
I
up
think it was
here.
higher up, yeah.
Is it right where the sock ends, right here? Okay,
Well, I cut the sock so it's down,
so it's down here?
it's there and then, yeah.
Okay, so what we're gonna do is we're just gonna put these on either side here. And then, when we put the sock back on, if it wants to cut, it's gonna have to go over that instead, so it won't cut right against the
Okay.
skin, okay?
Perfect.